Welcome back to ADBN News at 7, and now to Akwa Ibom, where the state governor, Pastor Umo Eno, has called on the federal government to support the state's health sector towards ensuring the availability of essential medical services to residents of the state. Speaking during the inauguration of some health facilities in the state, Pastor Eno stressed the importance of the health care in societal development, further underscoring the roadmap of the Arise agenda in giving the state's health sector keener and more intensive attention. The report.
Leaning on the global axiom that health is the backbone of any nation's prosperity and recognizing the terrain he operates from, where Nigerians visibly wrestle a significant challenge of weak access to quality health care, Pastor Eno has expressed commitment to continue changing the narrative for Akwa Ibom citizens. In his address, Governor Eno urged local government chairmen to replicate the health care projects in their various local governments to ensure that quality health care services are within the reach of residents, irrespective of their locations in the state.
It was one of our blueprint points on health in the Arise agenda. How we can get ambulances like we see elsewhere in the world to help our people real time, on time. Because in medical issues, time is of essence. And so we thank God today that we've been able to make this to happen. Our hope is that local government chairmen who are now autonomous will embark on projects like this, and they will see the standards that we have set so we can continue to replicate this and let our people have access to health facilities.
The governor further charged health workers in the facilities to generate revenue through efficient service delivery and with the aid of the facilities at their disposal.
But please, the doctor will know that this facility must make profit. We have done the analysis, we've looked at all of the cash flow plan. This is business. So you must collect your money. Don't tell me anybody bought on credit. You must pay, and the hospitals have to pay. And going forward, all of our hospitals in the state must feed from this oxygen plant.
Coordinating Minister for Health and Social Welfare, Professor Ali Pate, in his address, announced federal government's investment in healthcare delivery, with particular attention to the primary health care, noting that such huge transformation can only take place if the states and local governments can support through advancing primary health care in the various states.
I'll say one other thing. That His Excellency President Bola Ahmed Tinubu, whom you mentioned that you met yesterday, my understanding of what he's trying to do is to heal this country, to unify it, but also to inspire it through his efforts in various sectors of our society, working hand in hand with governors, with local governments, with other members of our society so that this country can be great.
Commissioner for Health, Dr. John Ekem, while appreciating the governor for his continuous investment in the state health sector, which he said has saved countless lives, highlighted the significant technological advancements in the state's health system.
When we say that patients are in critical situations and they are admitted, there's nothing the physician would do without the oxygen. So when we're talking about reducing maternal mortality, we need oxygen. When we're talking about reducing infant mortality, there must be oxygen. And so what the governor has invested in, I can tell you for free that the governor, by this singular investment, by a stroke of the red pen, has saved hundreds of thousands of lives.
The health facilities commissioned by the Coordinating Minister of Health and Social Welfare include the Akwa Ibom State Medical Oxygen Production Plant, Itukumbang, the Akwa Ibom State Emergency Medical Service and Ambulance System at the State Emergency Operations Center, Uyo, as well as the new Model Health Center at Wellington Basseway, Uyo. Mary Onyemechi, ADBN News.